Welcome to Sexology, a podcast that untangles the science of sex and pleasure. And now, with this week's episode, your host, clinical psychologist, Dr. Nazanin Moali.
Welcome to episode 73 of Sexology Podcast. I'm your host, Dr. Nazanin Moali. Today, we're going to talk about sex during and after pregnancy. This is a topic that I hear a lot from my clients. They talk about how they notice that the struggles around sex and intimacy started or got worse during that time. And I'm so excited and thrilled to have Dr. Stephanie Buehler on the show to talk about this topic. So Dr. Buehler is fantastic. I took her class as part of the ASAC requirement. She has a sex therapy education classes online and in person, and she's truly knowledgeable in psychology of human sexuality and anything related to that. So I was very excited to have her on the show. Dr. Stephanie Buehler is an internationally recognized licensed psychologist, an ASAC certified sex therapist, and supervisor. Dr. Buehler is director of the Buehler Institute, where she provides sex and relationship therapy as well as continuing education programs. She is also part of Hoag for Health Center for Wellness, where she specializes in helping women overcome painful sex, as well as helping high-risk breast cancer patients. She has published on sexuality for both professional and lay audiences, including her books, What Every Mental Health Professional Needs to Know About Sex, and Sex, Love, and Mental Illness, a couple's guide to staying connected. Also, she just published a book with the title of Counseling Couples Before, During, After Pregnancy, and gives lots of good information, especially if you guys are mental health provider, because even if you're only working with couples and not necessarily sex therapy, this book can be an excellent resource for you. Before we go to the interview, I just wanted to remind you guys, I really appreciate it if you leave us an honest review in iTunes. It will help us to reach a broader audience. Anyhow, here's my conversation with Dr. Stephanie Buehler. Welcome back to another episode of Sexology Podcast. I am so excited and honored to have Dr. Stephanie Buehler on our show today. Welcome to our show, Stephanie.
Thank you so much for having me. I am equally honored to be on your show.
Thank you so much. And it's just so wonderful. I was sharing with our listeners about the level of expertise that you have. You're not only a clinical psychologist, you're an ASAC supervisor, and you just published this wonderful book around sexuality after pregnancy. So I'm very excited to talk about this topic on the show today. So it's interesting that usually I see couples, when I talk to them, they say like their sexual challenges started after pregnancy, after like childbirth. And it seems like that's a common experience that they have. So can you tell us a little bit about what are some common sexual challenges that you see in couples during pregnancy?
Right. So, it's interesting that you say that because you're right. So many couples come in and they say, their sex life went off track after the birth of their first child, second child, third child, whatever. But I thought to myself, you know what? We're not looking back far enough. We just kind of accept that and don't ask anything further. Right. And so that's why I had the idea for the book. I thought, I want to know more about what really goes on. And so it really, there's no one set pattern for that couples follow during pregnancy. But we do know, and I'm going to quote research and try not to make it too academic, but we do know that couples that had sexual problems before pregnancy usually have sexual problems during pregnancy, and then those problems continue on afterward. So pregnancy definitely is not going to be helpful to anyone who's already struggling sexually. And as far as sexual changes, they are all over the place, as I said. So primarily for women, the first trimester, women are usually tired and they have nausea, and they're going through some psychological changes as well, with the idea that they are carrying a child. And so usually they're not too terribly interested in sex at that time. And then during the second trimester, most women report getting more energy back and feeling more like themselves. There are also some physical changes in the body that can make women more receptive or more interested in sex. And some women become very interested in sex during that middle trimester. Their hormone levels are changing, more estrogen in the body, and there's more blood flow to the pelvic area, and that means to the genitals as well. There are breast changes that some women find very erotic and sensual. And so some women actually have their first orgasm during that period of time.
Oh, interesting. I didn't know that. Oh,
right. I know. I did not know that either until I started writing the book. And I was like, oh, that's interesting. But it makes sense because there's all this blood flow and hormones flowing. And some women feel very sexy during their pregnancy as well. They feel very lush. And then there are other women that do not, but I'll talk about them in a little bit. But sort of towards the end of the pregnancy, some couples stay sexually active right up until, really until labor. But more typically, as the woman gets into that 8th or 9th month of pregnancy, it's very difficult to position herself for intercourse. And, she's probably tired at that point. Usually it's hard to get good quality sleep and that kind of thing. But sometimes couples are active in other ways, like they may not have intercourse. They may do a lot of cuddling and petting and enjoy each other that way. So that can be the case. And then on the other hand, you have some women who just don't feel good through the entire pregnancy. Some women don't feel sexy at all. They kind of look down and they go like, oh my God, look what happened to my body. And they don't enjoy, they like the idea of becoming a mother. Yeah, for the most part, I'm sure you've had the experience of having pregnant women saying, oh my God, this is, I don't know how I'm going to get into this role. But most women, of course, are looking forward to being in that role, but they don't enjoy being pregnant. And so that can take some of the fun out of having sex. They don't feel sexy. And then men, some men find the pregnant female form very erotic, kind of lush. They think it's like having a goddess. That kind of thing. Mm-hmm. And then other men look at that pregnant body and they go, nope, not interested. No. So some couples end up not having much sex at all during the pregnancy. If they both agree that, this isn't something that interests either one of them, it's not really a problem. Like, no big deal. Right. You just agree, I'm pregnant. I don't feel great. I don't feel sexy. You don't think I look sexy. Let's just agree that, we'll be affectionate with each other, hopefully. And once the baby is here, we'll get back on track. But there can be problems if you have a woman who feels lusty and her husband is looking at her partner is looking at her and going, meh.
That's not good.
That's not fun. That's not good. And it can create a lot of hurt feelings. And I have had clients, I don't get too many people coming in during the pregnancy. It's kind of, sex therapy is probably the last thing on their list, but I do get couples sometimes that I've seen in the past and, who had sexual difficulties. And I've helped them with that. But then during the pregnancy, the sexual difficulties kind of come up again, maybe in a different way. And I've had couples coming in with that kind of presentation where the guy is just like, not interested. And she feels very hurt. And, he's kind of like, well, of course I'm not interested. I mean, look at you.
Right.
Like, what? That hurts my feelings. I'm carrying our child and my body is doing all this work for us. And that's the kind of thing that you say to me? Like, how dare you? So, and then I have to kind of help them, help her understand that that is not a completely unusual reaction, but also talk to him about having some empathy for her, So it can be a tricky time. I've also had couples come in where the husband has had an affair during the pregnancy. So I've had couples coming in just a few weeks after giving birth because couples can be at risk for, unfortunately, for infidelity during this time. And there's also, which I don't really get into in the book, I mention it though, women are also unfortunately at risk for domestic violence.
Oh, I didn't know that.
Yes, yeah. And I was just recently talking with a gynecologist I work with, and she said, that they, sometimes things would happen where, a woman would have had intercourse, say, 2 weeks postpartum when she's really not supposed to be, because everything is healing. And they would have to go through very carefully to assess for domestic violence. So that can be a concern. Men experience all kinds of different mixed emotions and can find that very confusing during the pregnancy. So that's just something else, unfortunately, that we have to be aware of.
Right. And it's interesting and understandable when you mentioned that the research shows that like most people, so it kind of magnifies people's struggle. So if they had sexual challenges in the past, it might kind of magnifies the problem. So as you say, it's not helpful. And you were talking about issues about changes in the body. And actually that's a time I see some women that they have, and I know our listeners know, and I share it with you, I work with eating disorders, and some women kind of restart their challenges with eating disorders and body image and self-image. And that can be very tricky because they don't feel connected with their bodies and they don't want to have sex. And that can at times carry through their pregnancy and after giving birth.
Right. Yes. Right. I'm aware of that. I've had friends and clients who have struggled with eating disorders during pregnancy because of those changes in the body. It's very difficult if you're supposed to gain weight, but, if there's a struggle, an emotional struggle around that, it can be very difficult. On one hand, you want to make sure that you have a healthy baby. On the other hand, you can become preoccupied with your body image.
Right.
And it's a good time to get help to, talk about your feelings about those changes.
Absolutely. And something else I wanted to talk about is, in the movies, we see this stereotypical image of pregnant women wanting to have sex all the time, and we hear about it, read about it. And I'm kind of curious that based on the research and the experiences you have, how do you see pregnancy affects women's libido? What are some of the common things you see?
Right. So again, some women find with the hormone levels rising, that they do feel a surge of sexual energy. And in fact, I spoke to someone recently who said that she never had a drive except for 1 week during her pregnancy, which I thought was really funny. And she said, that was the 1 week that she was all over her husband, and he was, kind of looking at her like, "Who are you? What is going on?" So sometimes women can have a very strong drive during this period of time. And, again, with orgasms can be sometimes more powerful or easier to have an orgasm. So makes a woman more enthusiastic about engaging. And then on the other hand, you see, this is the thing, like there's no typical story here. On the other hand, sometimes with all that blood flow to the pelvis, sometimes orgasm can be uncomfortable. So it can, especially later in pregnancy, sometimes it can cause a prolonged contraction. It's not labor, but just a contraction in the uterus that can be kind of uncomfortable, or, the pelvic floor muscles can tighten up and that can be uncomfortable. So, in that case, sex is not going to be something that she's going to look for or look forward to. And, so her drive might really go down during the pregnancy. So I think that I guess my message on that would be to just kind of understand that there's no one way to be sexual during pregnancy, but to be aware that there can be problems that deserve to have attention. Because as I just said that men are at risk of engaging in infidelity, extramarital activity. And, if a woman is put on bed rest or she really has no drive or something like that, then the couple has to have a conversation about it. And we can't just assume that, oh, my partner is going to be so understanding of the fact that I'm on bed rest for 4 months. I think it's important to, say, have a conversation and say, okay, how are we going to get through this? How are we going, are there ways that we can be sexual? Maybe that I can, if a woman can please her husband during this time, or he can be with her and please himself, or they agree that he can be in private, or, that's an uncomfortable conversation to have.
Right.
And I realize it, but I think it's an important conversation so that the couple has a good understanding of each other during this period of time.
Right. And I agree with you on there's not necessarily one common presenting kind of way of presenting common way of experiencing sexuality during pregnancy, because I was working with someone and she was telling me that she didn't have drive similar to what you shared with us. And she felt so guilty because she didn't know that's a possibility. She just thought I'm going to have all these hormones and I want to have sex all the time. And that wasn't her case. And she said she was tired and she felt so bad about it.
Right. But, she shouldn't feel bad. I mean, that's just the way it is. Right. And I don't think that guilt is going to help her recover afterward either, because then she might feel obligated to be sexual with her partner and maybe too soon, maybe feel like, okay, 6 weeks and that's what the doctor said, 6 weeks. And now I need to jump into having intercourse and lots of it to make up for
it. Right.
So, and she might still be tired afterwards. So I think, both men and women have to be true to themselves and be honest about what's going on. They have to be tactful, and be gentle, because it is a big change. And, they have to have conversations about what the changes that are happening between them, within them and between them. And then, of course, there are psychological changes that go along with all of this that can have an effect on sexuality as well. So, some women turn inwards during this time and they're really connecting with I keep saying baby, but, it's with the fetus, but the imagined infant and what life is going to be like after baby. And so they're making those connections. And some men don't relate to that. And for some men, like the baby really isn't real until the baby is in their arms after after a woman has given birth. It's like, oh, okay,
I gotta see it.
Now we're talking, right? They're very concrete. So. And some men are kind of weirded out about, oh, there's something growing in there. And some women are weirded out about it.
Right.
Right. The most common, and I think this is important, that the most common reason, though, that couples may not have sex during pregnancy is that they're afraid of hurting the baby, or they're afraid that the fetus will know what they are doing. And I remember the first time I heard somebody say that, I couldn't help it. I just looked at them like my eyes bugged out. I went, what? And I said, well, it is a fetus, so it's not fully developed and it hasn't been exposed to anything social. So there's no way for the developing infant, to understand when you're having intercourse. But, there was something there. And I kind of felt, as a psychologist, I'm kind of analyzing everything.
Right.
And I'm thinking maybe this is just a nice way of couples saying, yeah, we're not really interested in having sex during this period of time. Like, you don't look sexy to me, and I don't feel sexy either. And so we're just going to say, we don't want to hurt the baby.
Being tactful about it, yes.
Yes, right. I think that's a way of being tactful. I think I don't even know that it's conscious. I think sometimes it's like, you know what? Yeah, I'm not interested. I might hurt the baby.
Right. And interestingly, I'm in second phase of like late 30s, and I have friends that they tell me like now they after years of trying or different fertility treatment, they just got pregnant, or like they're so scared because obviously their physician, like they go with physician's recommendation, but even when the gynecologist, fertility physician recommend them, that's okay, you can have sex, they still scared because they don't want to compromise on chance of having a child.
Yes, I've heard that. Yes, absolutely. I have heard that. I didn't come across any research about that, but I know clinically I have heard that. It's like, we invested so much time and energy and effort into creating this pregnancy that we don't want to do anything to risk it.
Right.
And then going back even further for those couples that are infertile, which I also talk about in the book, sexual problems and infertility. Those couples, sometimes those infertility treatments or having sexual problems that make it difficult to get pregnant don't get resolved very well. And so, they go into the pregnancies struggling, maybe with their relationship, maybe from the sexual issues that came up while trying to conceive. And, there's a ripple effect that can go on, I have found, for years. Sometimes like somebody is in my office and they have, kids in high school, and somehow we'll end up talking about, the marriage before babies came along. And they'll realize that it was infertility treatment or, just the struggle of trying to get pregnant that really got everything off track. And they never really talked about it. And that's the problem. There's not a conversation about it, and there's just an assumption, we'll just get back to normal. And what is normal after you've had a baby? Right.
Especially for few years. Yes.
Right. Yeah. So those are, the postpartum period is very challenging for couples. And, some couples do get things back on track. No problem. They had a good sex life before. They had a decent sex life during the pregnancy. They had a good sex life after. Usually those couples are seeing me because maybe there was infidelity or something like that, later on. So, we know that there are couples that have a good sex life before, during, and after, but we don't understand, I think, the struggles of couples that, had a hard time getting their sex life back on track.
Right. And for the postpartum period, is there any specific, I guess, like more common, like challenges that you see specifically for that part of the couple's life?
Yeah. So I think fatigue is probably the number one problem. And, some people are really very unprepared for all the changes that the baby is going to have on their lives.
Right.
Especially people these days are having children when they're older. And so they're a little more established with their routines and so forth. And so incorporating
right.
the infant, the routines and the demands of an infant can be very challenging. And also, having children when you're older, also it does make a difference. I had my own daughter. I just have one child. I have one daughter who's now 27. But when I had her, I was 34, and I had been a school teacher. I started teaching in my 20s, and I remember thinking, "Oh my God, I have so much more energy in my 20s than I do now."
Makes sense.
Like, I didn't think it would make that much difference, but it did. I was like, oh my gosh, So I would say the number one issue is energy, having energy. Another one is time, of course, because there are so many tasks associated with child care, more laundry, so trying to get meals made, whatever, pumping, if you're going to pump breast milk, you have to have time to do that, and so on. And then, our what's the word? Our leave policy, in our country,
Right.
we don't have a very good leave policy. So, women are often going back to work, a month later, and that's very difficult adjustment to make.
Right.
So there are all these different adjustments, just adjusting to being a mother, adjusting to being a father, and adjusting to having a family. Takes a lot of mental energy, emotional energy. And so sometimes there really isn't much left over for sex. Plus women sometimes, because they're doing a lot of, they usually are the primary caregiver, and there's a lot of touch involved. And, if they're breastfeeding, even if they aren't breastfeeding, they're still holding the baby a lot. They're cuddling the baby and playing with the baby. And all that touch sometimes makes them feel touched out.
Makes sense.
I just feel so touched out. Like, I don't want anybody else touching me. Like, please don't. Like, enough, so there's that. And there's, speaking of breastfeeding, there are sometimes issues around that, like whose breasts. I had a woman say, I don't understand whose breasts these are right now. Are they mine? Are they the baby's? Are they my husband's?
Right.
This very kind of complicated relationship that a woman has with her body, her breasts. And so, and then the husband, or the partner, I should say, now everybody's married, but the partner sometimes feels quite left out of the whole thing.
Right.
So, and he's wanting, he maybe really genuinely feels close to his partner because she, often he'll say, like, she did this miraculous thing with her body and it just makes me love her and I want to be close to her. And she's like, I don't have that same need as you do. Like, I'm happy. I've got the baby.
Right.
And I'm getting my needs met with the baby and, not really, kind of struggling to meet the needs of an infant and her partner. So there are all these challenges going on.
Right. Something else that I hear is absolutely from what you're saying. I can totally see exhaustion, frustration, all of that can impact people's desire level. And at times I hear from women that they went through labor, that they find sex painful afterward. Is that a common experience you hear?
Yeah, unfortunately it is. And so I don't have the number in front of me, but it's not a small number. It's, something like 20% of women 1 year postpartum will still find intercourse to be uncomfortable. Mm-hmm. And that can be for a lot of different reasons. Even if a woman has not had an episiotomy, which is, the surgical cut that is made to make the passage of the baby's head easier.
Right.
Even without that, there can be changes in the pelvic floor muscles just from carrying a baby. Mm-hmm. The baby is putting a lot of weight and exerting a lot of weight on the pelvic floor muscles. So there can be changes in those pelvic floor muscles. And that can be true even if a woman has had a C-section. So it used to be like for a while, women were saying, I'm going to have a C-section because I don't want any
right.
sexual changes from delivering a baby. But just carrying the baby can change the pelvic floor muscles. And also sometimes women going through labor before having a C-section will find that they have changes in those muscles. And then, of course, with episiotomy, there can be scarring, scar tissue that can be make intercourse uncomfortable. The good thing is that there are things that women can do. And so, my practice is in a pelvic wellness clinic. And so we have pelvic floor physical therapists who work with women before they deliver so that they have kind of well-toned pelvic floor muscles, and they'll have a better recovery. And then they will also work with women postpartum to help them with those pelvic floor muscles getting back into shape. So that can be very helpful. The other thing too is that sometimes women, before they have intercourse for the first time, they're so nervous that it's going to hurt.
Right.
Right? That they brace themselves. And I don't remember, I had a friend who said, oh my God, the first time we had intercourse after I gave birth, it was like he was putting a tree.
Oh my God. Not sexy at all.
Fortunately for her, she stuck with it and it got better. But, so women are nervous and they brace themselves like, oh my God, this is going to hurt. And then, of course, because they're all their muscles are tight, guess what? It hurts. So, what I would recommend to couples is to, first of all, wait until a woman is fully healed. And generally that's 6 weeks. That 6-week mark, though, it's not like getting a note from the doctor that says, okay, you can go home and have intercourse now. You have to be psychologically and emotionally ready as well. And if it takes a little longer than 6 weeks, then so be it. And, to be affectionate and, spend time together alone without the baby, if possible, can be very helpful during that time. But then when it does come time that a couple does want to resume intercourse, to make sure that they have plenty of foreplay, realize that a woman's body may have changed during the pregnancy, that things that, maybe she won't enjoy having her breasts touched. Maybe she won't want to be touched around her belly if she still hasn't gotten her belly back in shape. And that's okay, and she can communicate, what, this would feel good. This would feel good. Please, I don't think I'd like this. And so to have that good communication and to use lubricant.
Right.
Use lubricant. And, there's so many different kinds, but what's popular these days seems to be using coconut oil because it's natural, and a lot of people seem to like that. But if you don't like that, there are other types of lubrication. And that should be right there at the bedside, ready to use, and put a lot on her. And the guy should put some on himself as well, or she can put it on him and make that part of your lovemaking experience.
Right.
So, and go slow,
Right. And I love that you keep kind of emphasizing on communication, because I feel people sometimes just hard to communicate about anything with their partners that's sensitive. And I think we never learn how to kind of give a voice to our desires, what feels good, and especially what doesn't work. And and I think that can be very tricky. And it's just the key. If you're in pain, if there's something that's not working for you, it's important to talk about it. And you're definitely, I think, was very important, as you mentioned, to be tactful about it, because we're tired, we're under lots of stress. So we might say things in the way that's not helpful, and our partner might not be able to hear it. Do you have any tip as far as how to approach these sensitive things more tactfully?
Right. So I think if there's something difficult to talk about, and you're the partner that is going to bring it up, I think like sometimes if you have like a trusted friend or even a relative that you can talk it out with and come to some ideas about how you're going to state something to your partner, and that's not going to be appropriate for everybody, but some people do have someone like that in their lives, or a therapist is a good person to work things out with. I have people in my office often, if I just have the one partner in my office, sometimes we spend quite a bit of time. Like, how are you going to word this so that you don't hurt your partner's feelings, you get your message across, and you ask for what it is that you want, and they'll write it out. And I think writing things out is sometimes a good idea. Write out your thoughts, maybe put it aside, maybe bring it back, and then look at it, an hour later or something like that. And then make an appointment with your partner and say, you know what, there's something I want to sit down and chat about. And then, at that time, and you say to your partner, you can also say, if there's anything you want to bring up, think about it. We can talk about that too, and make an invitation to have a conversation. And then just sit down with your partner. And if you have to read it off, what you've written, that's okay. Or if you can do it off the cuff, that's fine too. And just present it to your partner in an assertive way. This is not about putting your partner on the defensive. This is about saying what is true for you and how it affects you and what it is that you would like as a change. Or you can say, what can we do to make this better? And make it feel like we are a couple and we are a team and we're going to work this out together. Not come to it as like, you're such a dope that you don't understand what I'm going through. What is wrong with you? How come you never understand me?
Right. And at that point, the partner is so defensive. Even if you're right, they're not going to hear you out. Yes.
Yeah. Right.
But it is tricky, as you said. And it's just, I like the idea of like people like writing it out so they can kind of process and think about and reflect on what she or he want to say versus blurring it out maybe in the middle of the sex or right after the sex and just kind of like get to this vicious cycle.
Right. Yes. And I think, to talk about your sexual experience right after having sex is a mistake because, typically we let our defenses down while we're having sex. And so there your partner is having let down their defenses and you're saying something, giving them negative feedback.
Right. Like scoring them. Yes.
Yeah. Right. Yeah. So that's no good.
Right. And I think one other thing that was very interesting in your book, you talked about the breastfeeding and its impact on sex. What are some of your thoughts on that?
Right. So, in our culture, in our American culture, the breasts are really seen as, as almost like almost defining a woman's sexuality. I mean, we're here in Southern California. The number of women who go for breast augmentation kind of tells you how important it is to have good-looking breasts. And so, making that switch from my breasts are something erotic, and they're erotic for my partner, but maybe also for me, and that I enjoy breast play, and I enjoy the look of my breasts, and then to switch and become, your breasts become a way of feeding an infant, not only feeding an infant, but also attaching to an infant, because we know that, breastfeeding, there's the eye contact that's being made and the touching, the cuddling that's happening. So there's a lot of bonding going on during that time. And so a woman may see her breasts very differently during this time. They may feel different to her. Sometimes, like you said, there can be changes in body image. I've had women talk about, how different their breasts looked as a result of breastfeeding, that they didn't like the appearance and it made them self-conscious. And so sometimes breast play is kind of comes off the table, which, can be difficult if that was a way a woman felt turned on or something like that. It can also be difficult for the partner because, like that woman said, are my breasts mine? The baby's his. He can feel kind of possessive about her breasts. jealous of the baby getting attention at her breast. Sometimes men find, some men find even being at the breast and feeding can be erotic for them. That's not much talked about,
Right?
But that can be true. Some couples think that's fun. Some couples think it's gross. So everybody is different at this time. And again, I think it just takes communication. For women to say, you know what, this is how I'm feeling about my breast right now. And for now, and maybe that will change soon and maybe it'll change later. But for now, they just kind of feel off limits I'm just not feeling very sexual about them at this time. And that's okay. Women have a lot of pressure these days to breastfeed. It creates a lot of tension for women. I've seen women become very depressed when breastfeeding is difficult for them. So it's a huge topic. I think when women are having kind of negative feelings about their breasts, truly negative feelings, that it would be good for them to talk to somebody about what's going on or having struggles with breastfeeding, because that can definitely be associated with postpartum depression. And that's something we definitely want to avoid.
Right. And again, I love the kind of idea of helping people to kind of express what they're experiencing and talking about it with their partners. Because from what I'm hearing and also from your book, there's just this range of different experiences people have around their bodies, around their sexuality, around their partners. And truly, there's not a right way of feeling or behaving. It's just a matter of making sure that you're talking about it and you're feeling okay about how are things going in your body and in your sex life.
Right, exactly. Don't, I think too often people say, well, things will just take care of themselves. And, some things do. Sometimes
Right.
things do. It's if you have a teenager, if you wait long enough, they become a young adult. And then
that's the only situation I can think of. Things get better.
Things just kind of work out. But most of the time, when we have a problem, just hoping it will work itself out is not a really great approach, because then we end up carrying a string of problems with us. And, once you have therapists always use that analogy of sweeping things under the rug.
Right.
So, have one little problem. Oh, no big deal. We'll just sweep it under the rug until you have a huge lump in the carpet and everybody's tripping over it.
Right.
How did we end up with this big problem? Well, you kept sweeping everything under the rug. So it's always healthier to sit down and talk things out and resolve them to the best of your ability, realizing that there may not be a perfect solution, but hopefully there's a solution that both partners can live with.
Right. And Stephanie, I love the content you have. You're full of this great information around sexuality. And I share with our listeners that I loved your blended program. So I bet many of our listeners want to get in touch with you. So what are some of the resources, the contents that you have that you think would be a good resource for our listeners?
Right. So I do have a textbook that is called What Every Mental Health Professional Needs to Know About Sex. And it's in its second edition. And I think really any therapist, personally, I think every therapist should have it on their shelf. It's a great resource. It's like having an encyclopedia of sex therapy interventions. So that's one. The other is I do have a website called learnsextherapy.com. And that is where people can find out about the programs that I have. I have the blended program. I have another program called the Core Knowledge program, and that's really for people looking for ASEX certification and only want to fulfill part of the requirements. And then the blended programs for people wanting all 150 hours towards ASEX certification. And then I'm also starting because I get emails from people from all over just really all over the world and wanting to learn more about sex therapy or sexuality counseling. And so I am going to be starting an international program.
Yay!
Yes, I know, right? With content that is suitable for anyone. Because I think in my the current programs, there's a lot that pertains to populations here in the States, like Asian Americans or African Americans. And while it's interesting for anybody to read, I think I wanted material that was very universal, and so that's what the international program will have. So same quality,
right?
Same quality, but just different materials. And so I'm very excited. I'm going to be launching that very soon, and people can sign up for a newsletter when they go to that site. I'll be giving webinars in the near future on various topics, and also book the kind of continuing education where you read a book and then you take an exam to get credit, because therapists love to read books.
You know us too well.
Yes, I know we do. I'm sure that we must account for a big percentage of book buyers. Because every therapist I know is always reading somebody's book on how to better understand the human condition and help people. How do we help these people that come to us and they're depending on us to show them a different way of doing things and make their lives better? And we're being able to share that knowledge with each other. It's very important. It's crucial to what we do.
Right. And again, I took the class, I attended your live classes and the online program, and I think the quality was excellent. I had 6 years of graduate program, but I didn't know much about sex. So most of the thing I know is from your class. So I highly recommend people to check it out.
Yes, definitely. Yes, I've had really wonderful feedback about it, and so I'm very proud of those programs. And they can email me as well. And an email that they can use is admin, so ADMIN, admin at the Buehler Institute. And that's a good way to email me. And I'm happy to send more information or answer questions.
Excellent. And I make sure that I'll leave all of those information in the show notes. So if you guys are interested, check out the show notes. I'll include everything in the show note. And Stephanie, thank you so much for your time. This was super helpful.
Oh, thank you. Thank you for having me on. I have to say, it was really a pleasure to be able to sit and talk about this very fascinating topic. So thank you so much.
Thank you. Have a great day.
You too.
I hope you enjoyed my conversation with Dr. Stephanie Buehler. Again, if you're interested in this topic, definitely check out her book, Counseling Couples Before, During, and After Pregnancy. We just scratched the surface with this interview. She provides lots and lots of great information in the book. Also, at the end, if you're interested to learn more about psychology of food, sex, and drug, check out my website at oasis2care.com. I'll talk to you guys next week. Thanks for listening to the Sexology Podcast. For more great content, visit www.sexologypodcast.com. Please be advised that information presented on this podcast is not a substitute for seeking help from a licensed mental health provider.